Okay, guys, so we'll be looking at another diabetes mellitus drug, right? So this is what is known as what? The insulin glargine. Insulin glargine. Let me keep it much more higher up here. Insulin glargine. So this insulin glargine, if you see images having it, this insulin glargine, alright. So it's a long-acting insulin analog. So it's used to manage blood glucose in individuals with type 2 and type 1 diabetes mellitus. Alright, so that's either if insulin is not being produced or insulin is being produced but the body is resisting it, so you want to add more insulin. Alright, so it's a long acting insulin, so provides a steady level of insulin over for 24 hours. It will now mimic the basal insulin secretion of the pancreas. Glucose uptake, it now promotes the uptake of glucose into muscles and fat cells. This will now help to lower glucose levels. So it also inhibits glucose production. Alright. So it also inhibits hepatic glucose production. This will now reduce the amount of glucose that is being released into the bloodstream. So what is this pharmacokinetics? Absorption is slow after subcutaneous injection, with effect beginning approximately 1 hour after administration. Distribution is widely throughout the body. Metabolism is in the body, primarily by the liver. Excretion is in urine and feces. Half-life is approximately 24 hours, allowing for one's daily dosing. Okay, insulin glargine. This is how it looks like. Subcutaneous, right? Subcutaneous administration. So it's used for type 1 diabetes mellitus where there's no insulin production, or type 2 diabetes mellitus where there's insulin production but there's resistance of insulin. Okay, side effects of this is like, in diabetes mellitus there's too much glucose, so it can now tilt you from having too much glucose to having low glucose. That's hypoglycemia. All right, then low potassium to hyperkalemia. So dosage is individualized. It's just based on the patient's need and how they are responding to therapy. Okay, so that's just it for what insulin glargine.